I'm Allegra Gast, and I'm a registered dietitian and international board certified lactation consultant. I'm a mom of 4, including twins, and today I've partnered with Momcozy to bring you some information about the top 5 challenges I often see and solutions. The first challenge I often see is engorgement. So engorgement is when your breasts feel very full and very heavy, maybe taut or tight. And engorgement typically happens within the first couple days postpartum, weeks postpartum, or if you've gone too long in between pumping sessions or nursing sessions. And so really what is happening, the anatomy side of it, is our breasts, our glandular tissue, our breast tissue, is made up of a bunch of sacs called alveoli. And I like to give an analogy of like grapes and like a vineyard. So you have a cluster of grapes, and then you have the vines, which are the ducts. And so your breasts are filled with these alveoli, these grape-like clusters, and that is what holds the milk. And as soon as you start pumping or nursing your baby at the breast, that is telling your brain to release oxytocin, which gently contracts those alveoli sacs to help push out more milk. Engorgement happens when these sacs get too full and too heavy. So if you're not pumping, if you're not latching your baby frequently enough, then these alveoli sacs are going to get very full and very heavy. And so we want to make sure that we're managing that engorgement. If you're engorged for too long, that may be a good thing if you have an oversupply, because engorgement tells your body to slow down production. It has too much milk, there's not enough room for it in the alveoli sacs, and so it's telling your body to slowly decrease production. If you are experiencing some engorgement, some things you can do is to gently hand express. So you can push your, put your fingers kind of like in a C shape and just help release some milk. This is called expressing your breast milk. You can latch your baby, but if baby's not emptying the breast, or maybe they only take one side and then this opposite side is engorged, then you could pump just to relieve the engorgement. So any milk removed is going to tell your body to keep making more milk. So I love recommending the Momcozy Mobile Flow. You could put this right in your bra, and that can help remove some milk to help manage that engorgement. Some other things you can do to help manage that engorgement is called breast gymnastics. So breast gymnastics is a term coined by IBCLC lactation consultant Maya Bowman, and she's done a lot of studies on this. And basically breast gymnastics is where you just pick up your breasts and you move it around. And what that's doing is it's elongating the milk ducts, and it's helping to send any excess fluid up to your lymphatic system. So our lymphatic system is one of our fluid drainage, one of our detox pathways. And so by doing breast gymnastics, you're helping to remove that extra fluid out to the lymphatic system, and then your body gets rid of it that way. The second challenge I see is sore nipples. And sore nipples can happen when a baby has maybe a shallow latch. So just like babies, just like adults, we have a hard palate. So if you put your tongue to the roof, you have a hard palate, and move your tongue to the back, you have a soft palate. So we want babies to get a deep latch to where your nipple is going far back to touch that soft palate. If baby has a shallow latch and they're just on your nipple, that nipple is being compressed by their jaw, by that hard palate, and it can be very painful. Sore nipples can also come about if you're using the incorrect flange size. So we come in all different shapes and sizes. So if you're using a flange size that is the incorrect size for you, then that can cause sore nipples. So the way to know if you have the right flange size is to use Momcozy's nipple ruler. And what you're gonna do is just put your nipple in the holes, and you want it to feel snug. You want it to fit perfectly. So you're just measuring the nipple. You're not measuring the areola, you're just measuring the nipple. So for this demo here, the nipple is about 5 millimeters. So I typically recommend adding 2 millimeters on top of that. So I would recommend that this person use a 17 millimeter flange. So then you would get the inserts, the 17 millimeter flange, and you would put it right in the Momcozy Mobile Flow in the flange right there. And that can really help with milk removal, getting adequate milk removal, and making sure that you're not experiencing sore nipples. But a big thing is definitely getting that deep latch, having baby get, wide open mouth and get that nipple far back. Oftentimes you might need to work with an IBCLC lactation consultant to work on positioning, maybe do an oral assessment. Sometimes babies have what we call a tongue tie. Ankylosing is the medical term, and that's when the tongue is tethered down by a piece of skin, and it prevents that tongue from having full range of motion. And so typically you need to work with a provider to release that tension so that the tongue has full range of motion. So if baby has limited range of motion, they're going to compensate, and that can often lead to sore nipples. The next challenge I see, challenge number 3, is refusal to latch. So sometimes babies have a hard time latching. If they're older, sometimes it's just plain out refusal. They've been so used to a bottle, or oftentimes in those early months, early weeks, parents think like, oh, baby just doesn't want to latch, but oftentimes it's actually just positioning, or they can't latch, and maybe it goes back to that tongue tie. So working with an IBCLC lactation consultant can be very helpful. I often recommend getting baby into that tummy to tummy, so their tummy is against your tummy. So just like us with our dinner plate, we have our dinner plate here. We're not facing outward and trying to lean over to eat our dinner. We're directly facing the plate. So imagine your breast being your baby's dinner plate. They're facing it. One arm is under the breast, one over. You're supporting baby by the nape of the neck, and you're supporting your breast. And then you encourage baby to get that deep latch to open up. So just like us when we eat an apple or a hamburger, we're kind of tilting our head back and then going in. So we want baby to lean back, tilt their head back, and then lead with their chin planting on the breast, and then the nipple goes far back in their mouth. So support is so important for getting that deep latch, because if baby doesn't feel very supported, they're thinking about balancing, they're thinking about being supported, and it's harder for them to think about eating. So we want them to feel fully supported. Their feet are also planted, like it's touching something, and all they have to do is just focus on that latch and just focus on eating. So really provide a lot of support, lean back. Once baby has that good latch and has a seal, then you can bring your arm forward and lean back. So that's often the position I recommend moms breastfeed in, is the laid back cross cradle or cradle hold. If baby is having a hard time latching, like you're working on the positioning and they just keep slipping off, sometimes it is that tongue tie, sometimes it's low muscle tone. So definitely working with an IBCLC lactation consultant can be really helpful to see why is baby having a hard time latching. The fourth challenge I often see is mastitis and clogged ducts. So we used to think that clogged ducts was an actual clog, like milk was getting stuck, it was creating a traffic jam, and that's why you felt like a hard lump in your breast. But we now know that it's actually inflammation of the milk ducts. And so when it's inflamed, it's kind of puffing out, and that's going to narrow the airway or the milk flow for that milk to go through. And so what we want to do is do that breast gymnastics. We want to make sure that milk is being adequately removed every couple hours. You're feeding on demand, watching baby's cues, making sure that the pump is removing milk efficiently. And then also making sure that you're sticking to more an anti-inflammatory diet, lots of nuts and seeds and omega-3 fatty acids, fruits and vegetables. And then hydration is also a huge part of that, preventing clogged ducts and inflammation. We also want to avoid any constriction. So if you're wearing really tight bras, sleeping on your stomach can often cause clogged ducts. We want to make sure that your breasts are getting movement. There's no compression on the breast, which could further contribute to clogs. So we want to make sure that we're preventing clogged ducts from happening. If you're getting recurrent clogged ducts, we definitely want to look deeper. So working with an IBCLC lactation consultant to see why you consistently getting clogged ducts. With mastitis, we used to think mastitis was an automatic infection of the breast and that you needed to jump to antibiotics. But mastitis just means inflammation of the breast, and it does not mean you have to jump to antibiotics right away. Some signs of mastitis would be warm to the touch. It would be red. So if you have any kind of red spots on your breast, if it's warm to the touch, if you start developing flu-like symptoms, those are often signs of mastitis. So we want to make sure that you're addressing breastfeeding, nursing on demand. Rest is going to be huge because mastitis does impact your immune system. We want to support your immune system, and part of that is rest and relaxation, making sure you're nourishing yourself, putting cold compresses on. So we used to think you wanted hot compresses, but we now know we actually want cold compresses. So just like with inflammation, we want to put cold on the area. So doing cold compresses, and then very gentle massage. We do not want to, be digging in there, and this goes for clogged ducts too. You do not want to use like a vibrator or toothbrush, mechanical toothbrush or anything like that, electric toothbrush. I've seen moms do that in the past. We don't want it to be aggressive. We want to be very gentle with our breasts. So if you're encountering mastitis, you might have flu-like symptoms for 24 hours. That's okay. If things progressively get worse, then I would reach out to your OB and, make sure that you're not at risk for an infection. But typically after 24 hours, if your symptoms are improving, that's a good thing. So as a dietitian, I do believe in antibiotics, but we do want to be smart about when we're using it, how often we're using it, because it does kill both the good and the bad gut bacteria. There is some research supporting probiotics to help with your breast microbiome, which is the good bacteria in your breasts. So you could consider some probiotics. Eating probiotic rich foods could be helpful for managing inflammation and just recurrent mastitis or clogged ducts. The fifth challenge I see is low milk supply. So low milk supply, there's two kind of pathways for low milk supply. Primary low milk supply is often related to health concerns. If you have any like thyroid issues, PCOS, insulin resistance, it's something hormonal that can impact your milk supply. If you have any anatomical issues, if you didn't have enough breast growth during pregnancy, you don't have enough breast tissue, that can impact your milk supply. So definitely like anatomy and health concerns. And then secondary low milk supply is often when we're supplementing. Maybe you're supplementing with like formula, and so you're not removing that milk frequently enough. So breast milk production is based off supply and demand. So the more you remove milk, that's telling your body to keep making milk. Sometimes any like trauma or stress or anything like that can impact your milk supply. Hydration, proper nutrition, and then also just making sure that milk is efficiently being removed. If you do need to increase your supply, making sure baby is nursing on demand, and then you might want to add in some pump sessions. So with the Momcozy Mobile Flow, you could just put this in your bra, and after feeding, just provide a little more stimulation, because any milk removed is going to tell your body to keep making more milk. So if you're needing to increase your supply, adding some pump sessions in can be super helpful. Nursing your baby frequently, making sure you're not going too far in between feedings, working with the IBCLC lactation consultant to help come up with a plan. Sometimes you might need to triple feed, which I do not recommend long-term. Triple feeding is where you breastfeed your baby, then you pump, then you bottle feed. That is not something that is sustainable. So if you're being told to triple feed, make sure you're working with a lactation consultant. You can do parallel pumping, which is where you breastfeed your baby. Maybe you offer both sides, and then as your baby is breastfeeding, you pump the other side. So it's like killing two birds with one stone. You're getting your baby latched and removing milk, but then you're also adding some stimulation with the pump. So that's parallel pumping. You can consider galactagogues. So galactagogues are herbs that may help with milk supply. So often like fennel, blessed thistle, moringa, so different herbs out there, oats. have been shown to possibly help with milk supply, but at the end of the day, it is that milk removal that is really going to help with your milk supply, as well as hydration, making sure that hormones are good, you're maximizing the breast tissue that you do have. So definitely working with a lactation consultant can help you with your supply. So those were my 5 challenges that I often see and how to navigate them. So sore nipples, engorgement, baby's refusal to latch, clogged ducts, mastitis, and low milk supply. Breastfeeding is hard. I know there are a lot of challenges, so I would definitely recommend reaching out to your local IBCLC lactation consultant, your breastfeeding support groups. I would also encourage you to join Momcozy's Facebook support group for more support. And I'd love it if you could share with this video with other moms, as we need more support. We need to find a village. So you're doing a great job. I know breastfeeding is hard, but with the right support, with the right tools, with the right information, it is possible to have a successful breastfeeding journey. Thank you so much. Take care.
Cozy Power by Momcozy.